CPAP is really difficult, I'm not gonna lie to you. However, we're here to help and make it as easy as possible. Here's what to expect for your first night and for the first few weeks of therapy. All right, everybody, it's me again, Narina, respiratory therapist at Lofta. I just wanted to get everybody set up on expectations on therapy, whether it's your first night or first few weeks. I do kind of want to give you some insight just because I know that every review that you're going to read online is going to say, I love my machine and I can't sleep without it. And you might be wondering how people even keep the mask on their face. So I'm here to just give you some feedback and let you know that you're not alone. So let's get started. Some first night practices that I would recommend is probably trying to wear it before bed, maybe hopping into bed a little bit earlier than normal. So take like 15 or 20 minutes to yourself, put your mask on and kind of test drive it. Kind of like riding a bike, the more that you do it, the easier it's gonna get. Something else I would recommend is probably reading a book, watching TV, or listening to a podcast. Essentially, we want you to distract yourself from your breathing. That can cause lots of claustrophobia and feelings that we don't want associated with sleep or our CPAP device. So by distracting yourself from your breathing, you should be a lot less anxious in your first few nights of therapy. Most people in their first 1 to 2 weeks of therapy are probably averaging anywhere from 1 to 4 hours of sleep on a nightly basis with their machine. Now, again, this is the average and this is what I would consider normal. To avoid being so frustrated with your device that you just want to give up, at that point, when you wake up in the middle of the night, don't be afraid to just say, hey, I'm going to try again tomorrow and set it off to the side. You're definitely not in a race with anybody and everybody works at their own pace. So if you feel like you can put your mask on without getting too frustrated, go ahead and do it. But if not, it's no biggie. If you feel like you've woken up because you feel short of breath, your mask was leaking, or maybe you weren't getting enough airflow, you can always reach out to your Lofta respiratory therapist and they can work with you on adjustments that can be made to kind of fine tune that for you. So our team of respiratory therapists really want to help you. If you have issues with the pressure you feel right at the start, your humidity settings, your tubing temperature, your pressure settings, just reach out. More often than not, I've noticed that people stop using their device because they think that there's an issue with it. Whether it's blowing pressures that are too high or maybe you have moisture in your tubing. And at that point, by the time they contact me, they haven't used therapy for several weeks. So it can get really hard to jump back on. I would recommend just reaching out at your earliest convenience so that way we can nip issues right in the bud and you don't have to worry about not using your device. This is a medical device, it's not a doorstop, so let's keep it that way. Because people really don't reach out and they're like, oh, I was suffocated the whole week. I'm like, well, you have all my information, dude. Now, the reason that we want a clinician to adjust your settings is not because we don't trust you, but because we have data in front of us. If you're making blind adjustments, you could be adjusting your pressure so low that it's not really opening up the airway effectively. So with some data to back up your, just some of your feedback, we can go ahead and make safe adjustments for you. And we also are experts in which adjustments should be made. So you might be turning off ramp or doing other things that might not really be indicated for what you're experiencing. So if you need some adjustments or you're curious about making pressure adjustments, just reach out to us and we'll have our team of respiratory therapists here to help out. You shouldn't feel like you can't use the restroom when you're using a CPAP device because you feel like you're tied down to all these wires. All you need to do is go ahead and hit the power button on your machine and take your mask off. The reason that I recommend that to get started is because if you wait for that smart stop feature to turn the device off automatically, you might be waiting a few minutes and you might wake up your bed partner. So just to be courteous, go ahead and hit the power button and take your mask off so that way the pressures are not blowing excessively and waking up someone in the room next to you. Anxiety and claustrophobia are really common, even for users that never experienced those types of feelings before. I myself dealt with it when I was trialing the CPAP device, so I know it's not the most comfortable thing in the beginning. What I would recommend is if you're very claustrophobic, instead of putting the mask on completely, hold it up to your face with just your hand. Once you feel comfortable in that sense, go ahead and actually put the straps on and start therapy. For some users, putting it up to your face can happen, that can take several nights and several minutes of practice on a nightly basis before you feel comfortable putting the mask on. Now, if your claustrophobia actually stems from the fact that you put the mask on and you're just kind of freaking out because of the airflow in the mask itself, I would recommend going ahead and restarting the device. So if you were to wake up in the middle of the night and those pressures are ramped all the way up, those pressures probably need to be ramped up to stent the airway open, but we definitely don't want you to be awake and on a pressure of 20. That's a lot of pressure. So go ahead and just hit the power button to turn it off, hit your power button again to turn it back on, and that'll start your ramp up period one more time, so that way you can fall asleep at lower pressures. A huge, huge help when you're dealing with anxiety in the middle of the night and some claustrophobia. I would say that 95% of the time someone's having trouble acclimating, it's because of their mask fit. So whether it's an improper fitting based on your adjustments or the actual mask size itself, we can always guide you through those things and work with you on how to make your adjustment as best as possible. On certain devices like the AirSense 10 and the AirSense 11, you do have the option of doing a mask fit test. So on the AirSense 11, that's found in your More menu. On the AirSense 10, it's found in your My Options menu. And basically what I recommend is you put your mask on. Again, don't worry about how snug or loose it is. And I want you to lay on your back. Once you locate your Run Mask Fit, go ahead and hit that button, and what you'll notice is that the pressures start really high and gradually decrease because the device is trying to understand if your seal is proper for low and high pressures. Of course, as the pressures increase, if your mask is a little too loose, it might start flapping off of your face. We want to avoid that. So with the mask fit test, try to lay on your back as comfortably as possible for the first 15 seconds, and go ahead and look at your screen to see if it's giving you an indication for a good seal or a bad seal. If you're getting a bad seal and you're noticing there's air leaking all over the place, go ahead and make some adjustments on your mask and do so evenly. So I would recommend adjusting the top 2 straps first and then the bottom 2 afterwards, so that you're not over tightening one side and creating leakage on the other. After a few seconds of laying on your back and getting that optimal seal, turn onto your side and repeat the process. That's going to be really important, and the device is not going to tell you to turn onto your side, but I would recommend it so that way you can avoid leakage when you're sleeping on your side, and that way you're not, fidgeting with the mask in the middle of the night and feeling like you hate the device before you've given it a real chance. So mask fit test is super important, and it's really one of my best friends. So let's go over things that might be normal and things that might not be normal. Things that might be normal include moisture buildup in your mask or your tubing, which can actually start to cause issues like tapping noises, gurgling noises, or popping noises in your tubing. Although those sound like really crazy problems, it's just as simple as increasing tubing temperature or decreasing humidifier levels. So that would be very normal. Things that I would say are not very normal is if your pressures are pumping at 20 right off the bat, or pumping at higher pressures than your start pressure right off the bat. So if you know that you usually start at 5, but you turn on your machine and it's reading a pressure of 20, reach out to us because there might be a faulty issue going on with your device. Something else that might not be normal is making sort of like whining or like whining motor noises. Your device shouldn't be doing that. It should be nice and quiet. You might feel a little bit of airflow or hear a little bit of airflow, but it shouldn't be making any sort of mechanical noises. Daily cleaning will be wiping down your mask cushion. So any portion that makes contact with your skin, whether that's the silicone that covers the mouth and nose or the silicone that covers just the nose, that needs to be wiped down to remove any excess oils that could be hindering your mask seal. If you have a memory foam mask, we're only going to be wiping it down and replacing that cushion monthly. Now, another part of daily maintenance that isn't recommended by the manufacturer or found in the user manual, but something that I like to mention, would be to dump out your excess water from that water tub and leave the lid open to air dry. That warm, humid water just sitting there all day without it being used can start to accumulate lots of bacteria. So if you're just dumping out the water and leaving it open to air dry, that can actually reduce quite a bit of bacteria buildup. And that takes care of daily maintenance. Weekly maintenance is a little bit more thorough. You're gonna take your mask, your tubing, and your water tank, You're gonna submerge those in warm soapy water using Dawn dish soap or something pretty mild for about 15 minutes. After you've soaked, you're gonna rinse all the water out and leave your supplies to air dry. When it comes to your tubing, go ahead and hang it up somewhere so the water can drain out. And again, if you have a memory foam mask, please do not submerge your memory foam in soap and water. You need to replace that on a monthly basis after you wipe it down daily. Okay, everybody, thank you for listening to me talk for the past several minutes. I'm sure you've probably heard my voice over the phone as well, so thank you for your patience. If you have anything that you want us to review for you in the next video, feel free to leave a comment below and we'll go ahead and get that right to you. Thank you so much. Have a good one. Bye. Okay, we're sweating. Okay, Scott, we're done.